Hey everybody, Dr. Michael here with Valiant Physical Therapy here in Evanston, Illinois, where I specialize in working with runners. Should you change your running form? What are the pros and cons of changing your running form? And what does that actually look like from a practical standpoint? And how do you know if you actually successfully changed your running form after you did it? So all these questions I hope to answer in this video, so stick around to find out. So the first question of should you change your running form, the first question I want to ask is, are you in pain? Is something hurting as you're running? A lot of times when people change their running form, when there really isn't any limiting factor or they don't feel like they have any pain, they don't really have any problem, changing the running form without any real reason could result in some sort of an injury somewhere that wasn't really intended. Because when you change your running form, you shift the stress of running from one area to another. And that can actually be extremely helpful for the people that are dealing with pain while running, because you can take the stress away from the area that's in pain and you can shift it over to somewhere else. And if you do that in a gradual, controlled manner under some supervision like a physical therapist, then the chances of injuring that area that's now being stressed is much lower because it happens on a very gradual protocol. And the injured area gets a little bit of a break because you're not stressing it. So should you change your running form? If you're dealing with some sort of a pain as you're running, likely there's something that can be done in the running form, in the running technique, that can improve your symptoms and take strain away from the area that is being aggravated by running. And so what does that actually practically look like? One of the simplest thing that you can do to simply improve your running form is ensure that your cadence is above 165. 165 and above is really a nice range for most people to have a short enough stride length that they don't really run into problems as they start to rack up the miles and do a lot of repetitive running. So the concept of cadence gets a lot of attention because it is one of the easiest variables to change, but changing your cadence is almost a secondary effect. Or how do I say this? When we are trying to change your running mechanics, cadence is the easiest way that we can actually have an effect on changing your stride length. Stride length is actually the variable that we're trying to change, and increasing your cadence at the same speed is the means to the end of shortening the stride. Because if we keep the speed the same and we increase the cadence, your stride length is going to have to shorten. And the shorter the stride, the tighter the run is, and the less impact forces that you really have to contend with in the ankle and foot and in the knee. So shortening the stride is usually a really good idea for most people if they're not already doing that. If they have a very reachy stride, their leg kind of goes out in front of them, their knee gets pretty straight. Shortening the stride is what we're after, not necessarily a change in foot strike. And the easiest way to shorten the stride is to increase the cadence. So with that being said, how can you increase your running mechanics on your own? The first thing to do is figure out what is your normal cadence right now at the normal comfortable speed that you're at. If you are less than 165, chances are you would benefit from bumping up your cadence a little bit to 165 or above. It gets a little bit tricky to figure out what cadence is actually right for you. That's where it becomes important to have some degree of help or some degree of third eye, or another pair of eyes, I should say, or recording yourself or things of that nature to actually figure out, is your stride length where it needs to be, and how does the rest of your body look as you're running? Not just focusing on optimizing the cadence number, although that is helpful for some people. You don't want to miss the forest for the trees. We're not trying to just optimize cadence. We're trying to optimize stride length. We use cadence to optimize the stride length. Okay, so I think I covered all the questions that I said at the beginning. Should you change your running form? What are some of the pros and cons? I don't know if I mentioned any pro. Well, the main pro being that you can shift the strain of the impact away from an injured area to a non-injured area, and that essentially helps you tolerate running better. One of the easiest examples of that, while I'm on that topic, is if you are having knee pain as you're running, likely the way that you're running is sending the shock of the impact to the joint of the knee. And this can also be said for people that are having a lot of hip pain while running or even low back pain while running. The way that they're running is putting too much impact pressure on the joints. And then what I do with a lot of my patients when I work on shortening the stride is shifting the stress of the impact to the muscles. So people will start to hear, or I'll hear patients say when we're working on their gait mechanics, hey, my knees feel great, but my quads are so sore, or my hamstrings are getting more sore, or I'm feeling my glutes finally. Those are indicators that someone is having a positive improvement in their running form when the stress goes away from the joints into the muscles. Okay. And I think that's pretty much it. If I can't really remember the first question, one of the questions I mentioned there at the beginning. But basically, there are pros and cons to adjusting your cadence. It's important to realize that we're trying to actually shorten the stride. That's kind of the main thing. And yeah, I wouldn't worry too much about changing what the foot is doing. Just try to keep doing the same thing that you're doing and just shortening up the stride. So there are benefits to working on your running form. Cons would be if you do it too fast or if you focus too much on what the foot is doing, you can kind of put some undue pressure on your calf. And basically, if you're not really sure what you're doing and you're just trying to change your form, you could actually injure yourself by putting too much strain too soon on an area that isn't really accustomed to it. So having some guidance and doing it with a professional is actually very helpful for a lot of people. So if you found this video helpful, give it a thumbs up, drop a comment, let me know what you think. If you have any questions, drop them in the comments and I'll respond and answer to all of them. And if you know someone that might benefit from the content in this video, send this over to them, and thank you for watching.